So I was wondering if you could give us a little bit of insight in how AI might help with prescriptions. So from two angles of this. One, every time I write a prescription in my EMR, I will get 12 different, major, minor, moderate interactions. Almost never are they of any relevance, and I just have to check the boxes. It's so annoying to tell me that, because it's completely irrelevant to what I'm doing. But the other part of this is that there's so much information about how we should be tailoring medications, whether it's pharmacogenetics or other things that we should be thinking about when we're writing the dosages and things. How could AI help us with those two issues?
Really good question, and AI is going to, in my opinion, take us to the next evolution on how medications are used. So as you're aware, a lot of drug development are typically based off certain populations and doesn't always account for others. So from that in and of itself, depending on your background, either race or cultural, there are going to have to be certain doses adjustments, and we will know which dose adjustments work for what types of people better, right? So as AI can synthesize more information, we're going to get the right dose on the right medication on the first crack. And we're already seeing a lot of use of pharmacogenomics in certain areas. So psychiatry, with some of these selective serotonin reuptake inhibitors, so antidepressants, and in some oncology meds, this kind of fuses this concept of precision medicine, pharmacogenomics. If I know if you're going to be a non-responder or a rapid metabolizer, then wow, I can adjust the med right there instead of giving it to you, see how you do when you have some toxic reaction.
Right.
And I was actually involved in pharmacogenomics integration into the EHR back in 2019. And it really hasn't taken off like I thought it would, because it's, 6 years later now.
Right.
But to your question exact, if I have all the information at hand, I can start to simulate responses to meds, leveraging AI. So I create profiles of different types of backgrounds of people or how their physiology works, and I start simulating meds. And in fact, that's how Moderna developed their vaccine so quickly, was a lot of this biosimulation. So the short answer is going to catapult us into a next, evolution or something of how it's used. And I think it's going to happen quicker than we think. We saw a glimpse of this with COVID vaccine, but it's going to come down to knowing who should be on what dose of statin, because as you know, statins are so effective, but not everyone responds to them. So maybe I'm the type of person that needs a very small dose, but it gives the same effect as someone who's on 40 milligrams of atorvastatin, for example. So imagine knowing that info and getting it right the first time. Whoa.
Yeah.
That's going to be a big deal.
That's an exciting future.
Absolutely.